Hi guys, my name is Agan, aka Men's Baby, aka Nene Agan, and I'm going to be doing my first paracentesis procedure today. Basically, I'm going to be tapping this patient's stomach to get out. It's a relieving procedure for this patient. Okay, so I'm going to tap it and get out some fluid. Yes, that's what I'm going to be doing today. So this is my surface area of work for today. See someone. Yeah. So this is my assistant for the day, Jessica, cheesy baby. Thanks. No, you thank you. Okay, so we have our lidocaine already in our syringe with the needle attached. We have our IV line that we're going to be using for the tapping procedure. Tap today. We have betadine.
Hi everyone, welcome to my YouTube channel. My name is Nene Agan, aka Nance Baby, and this is a video of me in medical school. This is an insight into Dr. Nene, literally. If this is your first time, make sure you subscribe, like, share, comment, turn on post notifications, tell a friend, and yeah, the video is already going on, so let me just join. I'm gonna give a brief explanation on the pathology and the procedure of ascites. Ascites is a word that, according to my research, is of Greek origin, and it basically means bag or sac. Now, ascites, the condition, is a pathologic fluid collection within the abdominal cavity, and it's caused when there is abnormal retention of sodium and water in the body. So from years of medical school, from years of knowledge, you know that in layman terms, whenever there is salt, water follows. So there's retention of sodium and water is retained in the body. So these patients end up having edema, can have peripheral edema, pitting edema, can have periorbital edema. In this case, this patient has ascites. And what we're doing here is paracentesis, also known as tapping. So we're basically tapping this patient's abdomen with a needle, and then there's a IV line / catheter attached, and then yeah, you're basically seeing what I'm doing, but you locate your McBurney's point, which is two-thirds of the umbilicus to the ASIS. You locate that, and then that is where you tap for the fluid. So I did the routine things you do when you're about to do any sterile procedure or surgical procedure. I prepped my work table initially, and then I prepped my patient. I got his consent to film this video. I got his consent to do the procedure on him. Basically, I explained the risk of the procedure. I did an abdominal exam, physical exam, just a short abdominal focus exam. I did what did I do? Yeah, I took his blood pressure, I took his vitals, and then I just got ready for it. So basically, I sterilized the area using betadine and then alcohol, and then I just put over the drip for this. After injecting the lidocaine and waiting for a couple minutes, I did a pinch test to be sure that my patient is not feeling pain in the area that I had anesthetized. So after doing the pinch test, I could now go on with my procedure. Now, according to all the assisting I have done on this procedure and all the videos I had watched to perfect my art before I was pushed into the battlefield to this, you have to, you've already located the points you're using. So using a syringe, I think I use a 10 ml syringe here, and a needle, you have to go perpendicular into the abdominal cavity. You have to go straight down. It's kind of a trace, like a guide wire, so to speak, for you to locate where the fluid is and how you're going to be tapping it. So I put that in, and then I aspirated and saw that there was fluid. So the IV needle I was using, that I am going to be using to tap this patient, I put it directly where I pulled out my needle from, and then I just connected the line. To be very honest, when I was doing this procedure, as soon as I had put the needle, I was supposed to put the IV line, but in my head at that time, it took me so long to catch myself because the fluid just started coming out as soon as I unclicked the IV needle. In my head, I was taking too long to get my stuff together because I was panicking. But then when I watched the video, it took me like less than 2 seconds to like collect myself and do everything properly. So I was very proud of myself, honestly. So this is how much fluid. Anyways, afterwards I secured the line on the abdomen and just let it drain and let it drain and let it drain. We got like 3 big bottles from this tapping. I was happy and I felt fulfilled. So after a couple minutes of the fluid draining out of the abdomen, I checked it to see, and then I did a bit of palpation to see if a bit more fluid was going to come out, because we had already disposed of about 2 bottles. That's around 5,000 plus mils. So this was like the 3rd bottle. So I was palpating to see if any more fluid was going to come out. Had to fill in the notes, obviously, the procedures of what I wrote. And afterwards, I took out the IV line and then compressed a bit. After compression, I dressed it. And yeah, we were done. That was how I did my first paracentesis. Well, yes, we're finished. We're done. Need another one. It's not to go this way. You could use plus one. After the procedure, after dressing the sites that I tapped, had to keep my patient and monitor him for a couple minutes, and then I did his vitals to be sure that his blood pressure and everything is in place. And then this patient in particular had his dialysis appointment, so he just waited and went straight to his appointment. And that was it. That's the end of my experience. Thanks for watching. Make sure you subscribe, like, share, comment, turn on post notifications, tell friends to tell a friend, and I'll see you in my next video. Bye.